Hello, my name is Samuel Vitebsky, and this is Lynch Syndrome, the most common cause of hereditary colorectal cancer. Firstly, what is Lynch Syndrome? Lynch Syndrome is an inherited syndrome that increases your risk of getting many types of cancer. This increases your lifetime risk. It follows an inheritance pattern of autosomal dominant, and as you can see to the picture on your right, the picture shows that only one parent needs to have the gene mutation for children to receive the mutation, rather than autosomal recessive inheritance pattern where both parents need the gene mutation to pass it on to their offspring. Lynch syndrome is a mutation in the DNA mismatch repair genes. The mismatch repair genes are genes that help fix the errors from DNA transcription and replication, and Lynch syndrome inhibits these genes from making those repairs. It is also known as hereditary non-polyposis colorectal cancer, or HNPCC. Some history of Lynch syndrome. Lynch syndrome was first discovered by Aldred Scott Worthen, even though he didn't know the name. He started a survey into Family G. His seamstress was talking with him about how her family had many children with cancer, and that she was worried that she would die next from cancer, and that Worthen discovered that she did die a couple years later. Worthen did the survey Family G and found that 6 out of the 10 children had developed some type of cancer, and that by the 3rd generation, over 47% of the children had developed some type of cancer. And you can see figure A shows the pedigree that Worthen created a Family G, and figure B shows the founder of the family. A couple years later, Henry T. Lynch came along and found many similarities with Worthen's survey with other families, so Lynch decided to have a family reunion with Family G, and he decided to do an in-depth survey of over 650 descendants of the family, and wrote his findings under Cancer Family G Revisited. You can see figure C shows Lynch's pedigree from the survey of 650 descendants. Currently, there are 3 diagnostic tools that doctors can use to help diagnose Lynch syndrome. First is in-depth family history. Your doctor would just take a thorough family history looking for factors like colon cancer, many types of cancer, specifically if they got it at an early age. There's tumor testing. There's immunohistochemistry, IHC testing, which applies a special staining process to tissue samples to see if certain proteins are missing. There are also microsatellite instability testing, MSI testing, which looking at microsatellites, which are sequences of DNA, to determine if there are errors or instability in the tumor cells. And then there's also genetic testing, looking for the genes and if they have been mutated and genes associated with Lynch syndrome. Some symptoms and treatments. Firstly, some symptoms of Lynch syndrome is the diagnosis of colon cancer at an earlier age than the average, family history of colon or endometrial cancer at an early age, and a family history of other types of cancer. And some treatments are a pre-cancer screening plan can be made with your doctor to hopefully find cancer early and stop it early. A surgery to remove most or all of your colon or uterus and ovaries. And early studies do show that taking aspirin daily could reduce the risk of getting Lynch syndrome associated cancers, but more studies need to be done. Currently, there are 5 genes that are associated with Lynch syndrome. The MLH1 gene found on chromosome 3, MSH2 gene found on chromosome 2, MSH6 gene found on chromosome 2, PMS2 gene found on chromosome 7, and EpCAM gene found on chromosome 2. And these genes are all MMR mismatch repair genes. And as you can see to the figure on the right, the prevalence of Lynch syndrome is about 1 in 3 to 1 in 500 cases. So the method my experiment took the purpose of the experiment was to categorize the risk of different cancers in these 3 groups: Lynch syndrome, Lynch-like syndrome, which were individuals from families without detectable MMR gene defects despite MMR deficiency, and the familial colorectal cancer type FCCX, which were individuals from families fulfilling the Amsterdam 2 criteria without any signs of MMR deficiency. And as you can see, the Amsterdam 2 criteria is listed to your right, and also the Amsterdam criteria 1 and 2 are used by doctors to determine if a family member does have Lynch syndrome. So some results from the experiment was when they finished their statistical analysis, they found that the risk for cancer by age 70 in the group of people with Lynch syndrome were 63.7%. In people with LLS, Lynch-like syndrome, 27.3%, and familial colorectal cancer type X, 25%. They found that MLH1 and MSH2 genes were carried a higher cancer risk, lifetime cancer risk, compared to the MSH6 gene, and concluded that the cancer risk for group LS was higher than group LLS and FCCX. And to your right, the figure shows the different groups, LS, LLS, and FCCX, the different groups' cancer risk compared to the general population and their cancer risk. And these are my reference pages. Thank you so much.